generality, what I'm doing for prostate cancer is I'm going to help support the hormonal pathways, estrogen and testosterone. I'm going to work on killing certain chronic infections that are many times involved, work on the inflammatory component, and work on the weakened immune system. Everyone that has prostate cancer has a weakened immune system and it's not working how it should. So we work on building that immune system up so it's able to go and kill the prostate cancer cells off effectively. I'm Dr. Jake Schmutz. I'm a naturopathic medical doctor and I specialize in integrative oncology. Here are the exact supplements that I use while supporting patients with prostate cancer. These are supplements that I use, but they are not replacements for traditional care. So when I'm working with prostate cancer patients, the first thing I'm going to be looking at is every prostate cancer patient isn't the same and every patient is a little bit different. So I look at the exact causes of what could be causing the prostate cancer in the first place. And this helps me put together the therapies that I think are best for the patient. I also need to know exactly what the patient is taking conventionally, because we can prescribe supplements and other therapeutics to help support the treatments that they're receiving to increase the effectiveness and decrease the side effect profile. So I like to get a whole history for my patient to really know exactly what to do. So a supplement I really like is called indole-3-carbinol or diindolylmethane, also known as DIM. So you want to make sure you get a really good high quality product. But what this does is it helps you make healthy estrogen. So it doesn't totally block your estrogen, but it helps you make the good estrogen. So this is going to help make more of the good anti-cancer estrogen and decrease the bad estrogen in your liver. A lot of times when people are thinking prostate cancer, they focus just on the testosterone. Those are a lot of what the conventional therapeutics are going to be working on, the drugs that decrease the testosterone production. But a big component is estrogen. A lot of people with prostate cancer have way too much estrogen, even compared to their testosterone. So testosterone is a component, but it's not the most important thing. Estrogen is just as important as that. Okay, so the next supplement that I really like is curcumin. So curcumin, which comes from turmeric, it's the anti-cancer or anti-inflammatory component of turmeric. It's really the most researched part of the turmeric herb itself, is what I like to use. And you need to do really high doses of turmeric or curcumin, and you need a really highly absorbed curcumin to be effective. But we're going to be using at least 2,000 up to 3,000 milligrams of curcumin to have that anti-inflammatory component and have that effective result that we want of decreasing the growth mechanisms of the cancer cells. So the next herb that I want to talk about is grapeseed extract. So this also works on the anti-inflammatory component. It also has antimicrobial activity. And there's a lot of research on grapeseed extract being effective on killing prostate cancer cells. So it's directly cytotoxic. So we need to do several different herbs, like I talked about, a curcumin, and then there's grapeseed extract. They work on different components and blocking different inflammatory growth mechanisms that help the cancer grow. So grapeseed extract works on a different component than curcumin, and it also is directly cytotoxic to cancer cells. And I like to do the combination of curcumin and grapeseed extract often for my patients that have been diagnosed with prostate cancer. Yeah, the next supplement that I wanted to talk about that I really love for prostate cancer is EGCG. EGCG is the anti-cancer part of green tea. So I like to take EGCG directly out of the green tea, so it doesn't have all the caffeine and all the other components of green tea, because really the best part that we have is EGCG. And usually the dose I'm prescribing, you would be drinking like 20 cups of green tea to achieve, and that's way too much caffeine for most of my patients to tolerate, or I don't really recommend getting that much caffeine. So we want to get pure EGCG, and I like to combine that with vitamin E. EGCG can be a little bit hard on the liver and has an oxidative effect on the body at these high doses, but when we prescribe it with vitamin E, it doesn't have these side effects at all. So if you are on some type of chemotherapy or immunosuppressant or a hormone blocking drug, you need to know what interferes or what doesn't interfere. A lot of these, like curcumin especially, interferes with a lot of different chemotherapies. So you need to know what curcumin works well with and what curcumin doesn't work well with, and actually decreases the effects of the chemo or makes the chemo actually be more toxic. So going to an integrative oncologist that understands all these things is very important, so you don't mess with the treatments that are being given. Also, you need to make sure you take them at the right dose and you get a good quality product. I'm Dr. Jake Schmutz. I'm a naturopathic medical doctor and integrative oncologist. You can set up an appointment with me by clicking the link below.